Attention deficit/hyperactivity disorder, more commonly known as ADHD, is a neurodevelopmental disorder. It affects both children and adults. The core symptoms of ADHD can be grouped into three categories: inattention, hyperactivity, and impulsivity. These symptoms are not merely occasional lapses, they represent persistent patterns that interfere with daily life. Inattention can manifest as difficulty focusing on tasks, getting easily distracted, and struggling with organization. Hyperactivity often involves fidgeting, restlessness, and excessive talking. Impulsivity, on the other hand, might look like interrupting conversations, acting without thinking, and difficulty waiting for one's turn. While ADHD is typically diagnosed in childhood, its symptoms can persist into adolescence and adulthood. It's estimated that ADHD affects millions of children and adults worldwide. The challenges posed by ADHD can significantly impact an individual's academic performance, work productivity, and personal relationships. The symptoms of ADHD can vary significantly from person to person. Some individuals may primarily struggle with inattention, while others might exhibit more prominent hyperactive-impulsive traits. This variability in symptom presentation is why understanding the different types of ADHD is crucial for accurate diagnosis and effective treatment. ADHD is not a monolithic disorder. It presents itself in different ways. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, recognizes three main presentations of ADHD: inattentive type, hyperactive-impulsive type, and combined type. Individuals with the inattentive type of ADHD primarily struggle with inattention. They may have difficulty sustaining attention, following through on instructions, and organizing tasks. Daydreaming, losing things frequently, and seeming forgetful are also common characteristics. Those with the hyperactive-impulsive type, as the name suggests, predominantly exhibit hyperactive and impulsive behaviors. They may be constantly on the move, fidget excessively, talk excessively, and have difficulty sitting still. Impulsivity might manifest as interrupting others, blurting out answers, and acting without thinking. The combined type of ADHD involves a combination of both inattentive and hyperactive-impulsive symptoms. Individuals with this type experience significant challenges in both areas, leading to a more complex presentation of the disorder. It's important to note that the severity of symptoms can vary greatly within each type. Diagnosing ADHD can be challenging due to several factors. One significant reason is the overlap between ADHD symptoms and those of other conditions, such as anxiety, depression, and learning disabilities. For instance, difficulty concentrating can be a symptom of both ADHD and anxiety, making it crucial to differentiate between the two. Gender also plays a role in misdiagnosis. Boys are more likely to be diagnosed with ADHD than girls, partly because they tend to exhibit more externalizing symptoms like hyperactivity and impulsivity. Girls, on the other hand, may present with more internalizing symptoms like inattention and daydreaming, which can be easily overlooked or misattributed to other factors. Another contributing factor is the lack of awareness and understanding of ADHD among healthcare providers. Some professionals may not be adequately trained to recognize and diagnose ADHD, leading to missed or delayed diagnoses. Additionally, cultural biases and stigmas surrounding mental health can also create barriers to seeking help and receiving an accurate diagnosis. Furthermore, ADHD symptoms can evolve over time. While hyperactivity might be more prominent in childhood, it may decrease in adolescence and adulthood while inattention persists. This changing symptom presentation can further complicate the diagnostic process, especially if individuals are not evaluated throughout their lifespan. Misdiagnosis of ADHD can have significant and far-reaching consequences for individuals. When ADHD goes undiagnosed and untreated, individuals continue to struggle with the core symptoms, leading to academic difficulties, work-related challenges, and strained relationships. They may face criticism, judgment, and blame for behaviors they cannot fully control. The emotional toll of misdiagnosis can be immense. Individuals may internalize negative messages, leading to low self-esteem, anxiety, and depression. They may feel like they're not living up to their potential or that something is inherently wrong with them. The constant struggle to meet expectations that feel unattainable can be emotionally draining and erode their sense of self-worth. Moreover, misdiagnosis can lead to inappropriate treatment. For example, if an individual is misdiagnosed with anxiety or depression when they actually have ADHD, they may be prescribed medications that do not address the root cause of their challenges. This can not only be ineffective, but also potentially lead to adverse side effects. Therefore, a thorough and comprehensive evaluation by a qualified healthcare professional is crucial for obtaining an accurate diagnosis. This evaluation should involve gathering information from multiple sources, including the individual, parents, teachers, and other relevant individuals who can provide insights into the individual's behavior and challenges.